Hi, my name is Philip Lee. This is my friend here, and we're performing 5 procedures for our pediatric adjusting practical final. First procedure here is going to be correcting a flexion restriction at the occiput. So you can do this one of two ways. The first one I'm going to do with the patient in supine. So it's going to be taking my lateral hand here, tractioning out the head. At the same time, taking a web contact on the forehead, and the line of drive is going to be S to I, P to A. I'm tractioning out and S to I, P to A, and just doing a sustained glide until I feel a release. And also do the supine with the patient on your lap. Thumb and fingers are here over the forehead. And same thing, line of drive, same S to I, P to A. And getting that sustained glide. Next would be a T5 extension restriction. So here you can hold the baby like so, and you can palpate until you find that T5 vertebra, and just on the TPs with my index finger. And we're going I to S, P to A, and holding that sustained glide until I feel a release, and then letting go. You could also perform this prone, and line of drive is going to be the same. So I'm taking my thumbs on the TPs of T5, I to S, P to A, and I'm sustaining that glide. Good. Last one we have here is I believe a left extension restriction. Of the SI joint. So I'm contacting the left side PSIS, and I'm going line of drive is I to S, P to A. I'm also, to assist in the movement, I'm going to be extending the hip out, putting the hip into extension, and again a sustained glide until I feel that release, and then letting go. Next we have 2 physical exam procedures. The first being the moral reflex. So I'm going to be holding the baby, just like this, big baby. And I'm going to be supporting the head and everything. And I'm going to mimic a drop. Same thing one more time. I'm going to mimic a drop. And it should elicit a response. The baby should be opening out the hands, flexing the head, extending the legs. Basically, just showing a reactive response to the drop. If there is only a one-sided response, that could be indicative of a clavicle fracture, hemiplegia, or a brachial plexus injury. So the baby isn't able to use extend out the arms or use them. And if it were a bilateral, unable to respond bilaterally with the extremities, then it could be a general central nervous system depression. And next we would have maybe here, and we're doing Barlow's maneuver. So here, taking hip and the knee at 90 degrees. So hip at 90, knee at 90, taking my index and middle finger and putting on the greater trochanter. And I'm going to be applying downward pressure. And I'm feeling for audible clunk, maybe to jerk or to express pain in response. And it could be indicative of a congenital hip dysplasia. So I'm going to do one side and other side. So same thing, hip and knee at 90, index and middle finger at the greater trochanter, applying downward pressure. Good. All right, that's going to conclude the exam.